Our last presenter this afternoon is Ms. Rose Naff, Chief Executive Officer of Florida Health Choices. Ms. Naff began her service-driven career in state government at the Florida Department of Insurance. She is a proven leader and innovator in the area of child health policy, outreach, insurance, and healthcare financing. In 1990, Rose joined the Florida Healthy Kids Corporation, which developed into a national model under her direction. She has assisted in implementing state and national healthcare policies, established fiscal guidelines for programs throughout the country, and worked closely with both state and federal legislators prior to being appointed CEO of Florida Health Choices in 2009. During her tenure with Florida Healthy Kids, Rose was recognized on numerous occasions for her efforts on behalf of Florida's uninsured children. In 1996, she accepted an Innovation in American Government Award from the Ford Foundation and the Kennedy School of Government at Harvard University. The program was again recognized by Harvard in 2002 as a sustaining model of public sector innovation of national significance. In addition, Ms. Naff received the 2005 Jack Hardy Healthcare Communicator of the Year Award from the Florida Hospital Association. Welcome, Ms. Naff.
Welcome, Rose. Thank you for coming.
Now, there's a pointer here somewhere. Before I go to the slides, though, thought I'd mention a little backstory related to my introduction. In 1990, I did take over a state-designed to implement a new program on a test basis in Volusia County, and it was known as Healthy Kids. In 1991, federal health care reform was afoot. People told me not to bother to implement the program. It was going to be completely unnecessary. The Clinton administration was going to save everybody. We ignored that advice. We moved forward with our experiment. Ultimately, that healthcare reform effort did fall apart. And Ed mentioned earlier, in the aftermath, there were additional changes that came about. Because we had such an experiment in Florida, we became part of the development of the nationwide CHIP program, and we were used to score the bill. Our benefits were grandfathered in. So I find myself in almost a similar position, starting a new nonprofit, trying to implement a program under state direction, and then there's all this chatter about what's going on at the national level. So it's, 22 years later, and I feel like I'm, reliving
God, I hope
the
history
entire thing.
repeats itself.
Yes. Groundhog Day, yes, there you go. But we are implementing state law. The Supreme Court's decision does not affect state law. It did not change our mission, and we are moving forward. Our mission is in statute, and we are very close. There was an article today. Jim Turner referred to us as being a few clicks away from reality and compared us to Expedia, the travel giant. He happened to be present when we did a WebEx yesterday for our board of directors. We've actually done three WebExes. I'm sorry I'm not able to present that to you today. The screenshots that we're going to go through do not do the system justice, but I do want to point out some of its features. But as a little bit of background, we are in the process this month of certifying vendors who want to join the marketplace. We are commencing the vendor onboarding process. We are engaging in user acceptance testing beginning next week. September 1, we expect to enroll agents. They will register at the marketplace. Beginning in October, those agents can bring employer clients to the marketplace and get rate quotes for their small groups. November and December, we can enroll employees of those employers, and coverage can begin January 1. It is a voluntary marketplace. It's voluntary on the part of vendors, the insurance industry. It's voluntary on the part of employers and agents. It is not limited to health insurance products, but phase 1, this first launch, is going to be small group products for groups of 4 to 50. Which button do you push? This one. This is a representation of the main landing page. You can see the boxes across the bottom. One is for individuals, one's for employers, employees, and then the one to the far right is for agent pathfinders. I'm not going to spend a lot of time on all of the slides. Some of them are more interesting than others. This is where an employer would, either an agent acting on behalf of the employer or the employer himself may come in and start to register his group. Here he's building the census, adding his employees, their ages, the number of people who would be covered. On the far right, down at the bottom, there's a little blue bar where they can add another employee. There's another blue bar above that, though, where they could use reports from their payroll system to automatically upload their census without having to fat finger it in. So it's got some flexibility. Once the employer enters his census, he'll be presented with, based on the geographic area where he's located and the census information that's provided, we'll be able to look at the vendors, the insurance companies who are offering in the marketplace. This data, the rates, and the companies that are represented are California data that our vendor, IT solution vendor, is just borrowed from other solutions that they have. This is not representing Florida by any means. In the upper left-hand side, there's two little boxes. This is where an employer can adjust the contribution amount that they want to give to their employees, which will change the boxes to the left by recalculating the employer's contribution and the employee's contribution to the overall cost of the group. On the lower left-hand side, there are several options. They could shop by just the plan type. They might want to look just at HMOs or just at PPOs. They can also shop by sorting the monthly premium they want, a cap perhaps that they want to have for the whole group, or by deductibles. So there's some additional shopping options. The employer or agent can also click on a company and it will come back and show them by employee how much coverage is going to cost both on the for dependents and for employees, and give a total for the employer. He can also print out a side-by-side comparison. He could have gone in the previous slide and picked 3 or 4 different plans. They will go into a little temporary shop cart, and he can click and print side-by-side comparisons of each of the companies that he wants to consider. He may decide he's tied, maybe he's not really sure, but he wants to get quotes from 3 different companies perhaps, or let's say 4. We have, with the vendor steering committee's assistance, we have designed, and the vendors who will participate have agreed to use a single standardized medical questionnaire for underwriting purposes. The vendors will be notified that there's a rate quote is requested, and the vendors will return small group rates within 2 weeks. Those are presented to the employer by the agent, and the employer then would pick a single company to offer coverage and up to 4 plans that his employees can choose from. So there's more choice. It's a little easier for employers to get their rates because they've got a single standardized form for medical underwriting purposes, and there will be more choice for employees. I went too far. Okay. Once the employer has picked the company and the 4 plans that he wants the employees to shop from, the employee then receives an email notification that they're invited to enroll and shop. So this is just an employee registering initially and building their family detail. So we had the employee census, now we have the family detail. Lower left-hand corner, you can see the individual family members are named there, and more detail about their ages, which then returns a similar looking presentation of the plans now that the employee can choose from. This is a little busier slide. It's got some really cool little doodads on it that I want to kind of walk through. This is why I wish I had the live WebEx. At the very top, there's 4 blue boxes. That's actually Connie, Susie, Harry, and Mom. I mean, so it's showing you all the family members. You can actually go and click on those family members and take them out of the computation and click them and put them back on. So for instance, this family of 4, possibly the children might be eligible for Medikids or Healthy Kids and don't need coverage in this group. So they could check what the cost is going to be with the child in and with the child out. On the left side, with in the gold and blue box, again, there's 4 tabs. It's Susie, Connie, and Harry again. And you can, with this calculator, this is an out-of-pocket cost calculator, and the slider bars that you see, I'll talk about the top slider bar, is for Shirley, the estimated number of primary care visits that Shirley will have during the year. You can slide that bar to further right you go, the more primary care visits are being calculated, and therefore the out-of-pocket computation that goes with each of those visits. The next one down is the emergency room visits that are estimated, and then more specialist visits that are estimated. And at the very bottom of the gold box, you can assign the number of drugs, whether they're generic or specialty drugs, and compute, again, the out-of-pocket for the year. You can do that with each individual family member. That's what the 4 tabs are at the top. As you do this, the first white box to the right starts to change. So you can see your monthly premium and your estimated annual out-of-pocket. I think that's cool. For future development, this will not be in our initial launch, but in the initial launch, we will have at each of the plans, there will be like a link to their provider directory so that a shopper can go and see if their preferred physician or hospital is in the network, just like they do today. But when we complete the physician finder, the employee can go in and enter the last name of their preferred doctor, or they can do a geographic locator and hit next. That will return, I think the example we saw yesterday was Dr. Smith in Los Angeles, and it returned all the Dr. Smiths within, I think it was 25 miles was the sort feature, and then presented their location and a side-by-side comparison of the health plans that physician participates in. And that physician was in maybe 5 of the companies, but not in Kaiser Permanente. So we can also do this with hospitals. We can do it with, they can actually put several physicians into a temporary cart and get a side-by-side comparison of those providers. For instance, the languages that they speak, the specialties that they are, the credentials that they have. So it's actually a very nice feature. Similar to the physician finder and a future enhancement is the drug finder. In this one, for instance, maybe Shirley's son or daughter, Connie, I think it was in the example, may need Advair. So this would go out and again do a side-by-side presentation of the plan options that are out there, which ones cover Advair. It can make a difference in, definitely, in who you sign up with. Then we have some self-serve portals. This is going to be the employer portal, where an employer can go in, put a new hire in, get a quote for the new hire, the new employee, edit employee addresses. So the agent can do this on behalf of the employer, or the employer can do it themselves. The employee portal has some good features. On the left-hand side, they can just view their benefits and their history. They can order additional ID cards, and they can update their info. For instance, in a life event, birth of a child, if we were to click on update my info, it would present all the options for life events, adoption, birth, marriage, divorce, and it allows them to self-serve the changes to their enrollment detail to go with it. We also have a back office for agent pathfinders. They can get additional quotes, do online enrollment. There are reminders if a client has not paid their premium on time, it will notify the agent. It will notify them when they're coming up for renewal. There's actually a calendar behind there that maps out what they're what's coming up next. They can look at their existing coverage clients, and they can park new groups that are coming on that they're developing that maybe aren't ready for a quote yet. So there's a lot of, I could turn the page. There's a lot of functionality that goes into the agent portal. We do have, we are working closely with the Division of Agent Agency Services. When an agent registers, and this will begin September 1, they will enter their last name and their Florida license number. We have access to the agent licensing database, and it will return an immediate confirmation of their license and its status and all the companies that they're appointed by. It's designed to be easy and inviting for the agents. We've done one big WebEx for the vendors. We had a vendor mini conference at the end of June, and we did another WebEx for the agent steering committee last week. There are a couple people in the room that have also signed into the WebEx from time to time, and I don't know if you want to ask them their impressions or not. Thank you.
Thank you very much, Rose. It's an interesting tool that's going to be available, I think, and to get products to employers in making choices. It's a really great program.
Thank you.
Questions?
We're excited about it.
Hi. I appreciate that you did use an agent steering committee in developing this, and I think it's going to be extremely functional and useful. I did have a couple of questions just on details. When an employer or an agent terminates an employee, will it hop into the COBRA functions?
We will not be doing servicing COBRA. There are smaller groups that will be subject to the normal mini COBRA requirements, and the larger groups will, a lot of them have their own COBRA providers. We can do that in the future, but for right now, we've just got to get it off the ground.
Because I love the streamlined, nature of this. The other question that comes to mind, and it may be too broad for this discussion, but tell me if it is, are these plans priced similar to how they're priced in the market, or is there different rating for the groups once they come into the marketplace?
We are devoted to making this easy for everyone. It is voluntary, and the small group products that are being loaded now are approved rates that are already approved by OIR, and products and rates that are already approved by OIR and on file. We would hope that there would be no need to change rates just to be in the marketplace.
And you mentioned an expansion of products beyond small group. Can you elaborate on that?
We do have some identified individuals that in statute that we're to reach out to with individual products. We have scheduled individual products to come on board in the middle of 2013 so that we can enroll people in the fall of 2013.
Excellent. And I understand you're speaking at the Florida Association of Health Underwriters Symposium.
Yes.
In August. So we look forward to that. Will be almost at your launch point. So great way to reach out to the agents there.
Yeah, and we are planning to do focus groups with agents at that meeting. We have 3 focus groups planned. One will be with the steering committee itself, but then 2 like random. I'd encourage you to participate if you're interested in one of the focus groups. In addition, we're working on the agent training. Most of what we'd be training agents on probably is not going to qualify for CEUs, but we are working with agent agency services to see if we can at least get partial credit for the training.
Thank you.
Rose, when you talk about the rating, are you basically saying that people are not going to do underwriting rating after the process, after the information shared with the carriers?
The portal is going to present the standard small group rates. Right. Then this underwriting process takes place, and I will call it the interim small group rate returns. Right. And then after the census is fully completed, if it requires more than a 5% adjustment, then there can be that adjustment made by the companies, just like you do today.
Right. What about with groups of under 10 where the statute talks about billing, and if employees change during the year, that would change the billing?
You're going really deep there. As I recall, it was the group is covered until renewal, and then they're re-examined. I'd have to go back and look at the detail in the solicitation of interest.
Just last, and this is more recommendation, I guess.
When this goes live, September 1, the only button that will actually be active is the Agent Pathfinder button. And then October 1, you'll see the Employer button will become active, and then later on. So yes, there will be like a design box, but it won't work. There won't be an individual click.
I'm just going to encourage you to say coming soon or something.
Yeah.
We found that it's a real issue.
Yeah, in fact, it won't even say individuals. It'll probably be just a nice little picture. I will let you know, Mr. Chairman, I will let you know, we are certifying vendors now. I have fully certified 3 vendors and referred them for the onboarding process. We have signed non-disclosure agreements with them just there while they're considering getting in, and until they actually make the final decision to let it all go to the public facing. Just the fact that they're considering is being considered kind of a business, internal business proprietary kind of a thing, but we hope to make an announcement soon. We'll have health and dental products that we're offering, and I have 3 more vendors that we're actively negotiating the terms of their non-disclosure agreements right now. So, and we really, in order to make this offering August 31st, September 1 for agents, we really do have to have companies give us their signal that they're serious about considering it in the month of July. So we have only about another week and a half of this kind of open period for vendors.
I congratulate you on the progress you've made on this, and that's an important contribution to the agent community, employer community, and employees.
This only works with agents' involvement. I mean,
Amen.
yeah.
Right, Jenny?
Just to note that the front end of this is the easier, more streamlined things, and yes, anyone could navigate through it. It's when you hit that plan detail button, and all of the details come up of the various plans that are different, and they're working to get some streamlinedness to that. But there will always be the need for explanation when someone's financial and health well-being is in play.
Joni, I know the difference between buying an airplane tickets and a health insurance policy.
Thank you, Commissioner.
Well, what if a agent comes in and the client selects a plan that agent's not licensed with? How does that work?
State law now allows agents who are not appointed to ride, I think it's up to 25 before they're appointed. So the companies can.
Assuming the agent was appointed with the carrier, would he be paid his commission just through the regular company channels, or?
Yeah, we'll have their license number, and when the enrollment, we're not going to process the commissions on their behalf. We will be passing through the agent identifying numbers to the company
carrier,
who will, whatever their normal commission rate is, we have informed the vendors we expect them to pay the same commission inside and outside the marketplace.
I just want to make sure I get paid, that's all.
All you have to do is write some business.
I will.
Okay, good.
I did want to make one more note. This works very well with our tech-savvy employees, but we do deal face-to-face with so many employees still in markets that you can't just send them an email. So have you considered that, and how would we include them in this process?
Yeah, this first launch really is going to be limited to, just to get it out, is going to be electronic, but our vendor Xerox is required to develop to support paper applications. But I will mention this, even this in the soft launch, even though it is web-based, a phone call to the statewide call center that will be based here in Tallahassee, our customer service reps can complete the application on their behalf over the phone. So we do have that. There will be a Spanish version launched in March of 2012, and there will be Spanish and Creole support at the call center, and even before and after the additional languages are available.
Great job. Congratulations.
Thank you. It's fun. I've really enjoyed doing it.